How often should you be feeling your baby move? I'm a labor and delivery nurse, and I'm going to tell you. So, clinical studies show that an average of all pregnant women usually feel about 10 fetal movements in a 20-minute period. Now, healthcare providers like to see about a 6 or more fetal movements in a 2-hour period. So you can see there's a big variation there. Usually people will feel a lot more than 6 movements in 2 hours, but that's kind of our gold standard. We like to see a lot of fetal movement because that means that it's a well oxygenated fetus, which means they're getting enough nutrients and oxygen from the placenta. Now keep in mind that babies tend to sleep for about 20 to 40 minutes, even up to 60 minutes while inside your uterus. So those are their sleep cycles. So you might notice a decrease in fetal movement for about 20 to 40 minutes, and then it will pick back up again. Take into account that some things that can decrease fetal movement are smoking, using narcotics or any kind of depressant drugs, and then other things that can actually increase movement of the baby is stress. So if you're feeling really stressed, the baby will actually increase their movement. So if you're worried about too much movement from the baby, maybe you're stressed and maybe you need to, sit down and take a few deep breaths. Now, I know you've probably heard from people, sit down, have a cold glass of water, drink some juice, and this will get the baby to move. It's not actually scientifically proven, but from a labor and delivery nurse, I have seen this work. So if you are worried, it's not going to hurt to try. Another thing you can do is lie down on your side and do what's called a kick count. So a kick count is basically where you just focus all your attention on the baby and see how much they move. You're going to want to be feeling a few movements in about a 10-minute period. You're probably going to want to feel a few movements. Again, the gold standard is 6 movements in a 2-hour period. Now, I'm not saying you need to lie down for 2 hours, but if you're noticing a decrease in fetal movement, you can always call your primary health care provider, your OB, your midwife, or anyone who's been following you throughout the pregnancy. I am a nurse, but I am not your nurse, so it's always better to get checked out by your own healthcare provider if you have any specific questions about your baby and how much they are moving.